Hello, my name is Janelle. I'm a Texas Tech nursing student.
For your safety, will you verify your name and age for me?
Dorothy Reed, 62.
Awesome. And what's today's date?
January 27th, 2022.
And what city do you live in?
Huddle, Texas.
Awesome. We're just going to do a quick assessment on you and just kind of check your breathing, some of your physical strengths, and how you walk and things like that, okay? Mm-hmm. Okay, so let's start with your hearing. Do you wear any hearing aids or any assistive devices? No. You have any problems with your hearing?
No.
Okay, I'm going to whisper a couple of words into your ear and I want you to repeat them back to me, okay?
Red brick,
Good.
train track.
Good. And do you have any problem breathing at all? Okay, can you go ahead and put one hand on your nostril and take a deep breath in? No. And do the same on the other side. Good. And did you have any issues with breathing?
No.
Okay, so it doesn't sound like you have any issue. You're breathing normal. Now I'm going to palpate your lymph nodes. I'm just going to kind of feel and make sure everything is nice and normal. First, I'm going to do the post-auricular, submandibular, and supraclavicular. Good. Okay, now I'm going to just check your ocular movements, meaning your eye movements. If you could just keep looking at this pen, keep your head still, okay? Mm-hmm. Good. 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 Your eye movements appear normal. Now I'm going to take a listen to your heart, okay? Here. Good. Now normally I would do this underneath your clothing, but for the purposes of the video, that's why we're doing it above the clothing. I'm going to take a listen to your lungs. If you could just take a deep breath in, okay? Deep breath in. Sides here. Okay. Now listen in the back. Move forward for me. And deep breath. Both sides are nice and clear. Okay. Now we're going to do some strength tests. Okay, I want you to, I'm going to start with your head and we're going to work our way down to your feet. You could just put your head up against my hand. Good. Now do this with that other hand. Good. And go forward. Good. And back. Okay. Now we're going to do your shoulders. You can just come up against my hands. Good. Now we're going to test your hand strength. Push up against your hands up and push up against my hands. Good. And down against my hands. Good. Now out. Good. And in. Good. And squeeze my fingers. Awesome. Now I'm going to do the same thing to your knees, okay? Okay. Bring your knees up. Okay. And can you bring them out? And in. Good. Okay, now we're going to do your ankles. Bring your ankles back against my hand. Okay, and push them forward. Okay, and out. And in. Good. Now we're going to do your toes. If you can flex your feet up this way, up against my hands. And down. Perfect. It doesn't appear that you have any issues with your strength. It's very good, normal. And now we're going to do what we call a Tonetti assessment, and this is going to check your balance as well as the way that you walk, okay? So we'll first start by, if you could, since you're already sitting in the chair, which is great, a nice stiff chair, I want you to raise up. Good. And can you bring your feet together? Good. And about 4 feet apart. Good. Now I'm going to do what we call a nudge test. I'm just going to place my hand up against your sternum here, and I'm going to nudge you back a little bit. I'm going to keep my hand behind you, so make sure that you're nice and safe, and we're just going to test your strength and your balance, okay? We're going to do it 3 times. Ready? Okay. Good. Okay. Now I want you to close your eyes for 10 seconds. Ready? Good. Okay. Now can you go ahead and take a step forward for me? Because I want you to make a complete circle. Turn around in a complete circle. Good. Okay. Go ahead and have a seat back here. Good. Okay. Now we're going to test your gait, which is your walk. And what I'm going to want you to do in just a minute is stand up, and I want you to walk to this wall. And then I want you to turn around and walk back a little bit faster than you walked that way. Okay? Okay. Ready? Okay. Oh. Okay. Okay, so your gait seems normal. I know you kind of tripped there at the end, but your gait does seem normal, and your strength is normal, so you don't appear to be a fall risk. Now, I did assess your home when I came in, and you didn't have any rugs or loose rugs or extension cords hanging around, so that's great because those do pose fall risk for you. Do you have any pets?
No.
No pets. Okay. And do you have any grandchildren?
Yes.
Okay. And what are they age?
6 and 4.
Okay, so they're young.
Mm-hmm.
So with grandchildren come toys and gadgets and gizmos. So we want to make sure that they're just picking up those toys, and you're checking the floor because we want to make sure that you don't have anything on the floor for you to trip over, because that is a fall risk. It does pose a fall risk. So we just want to make sure that we're making sure they're cleaning up their toys and they're not lying around. Mm-hmm. We also want to make sure that we keep the medications safe. Where do you keep your medications currently?
Either in my purse or my medicine cabinet, but I do keep some in my purse.
Okay, so with the purse, you want to make sure that they're not at easy access for the children, because medications and things, and then that the medicine cabinet is high enough so they're not able to reach them and get exposed to them. Now I know we reviewed your medications earlier. And you are on Medicare and you have supplemental insurance, is that correct?
Yes.
Okay, and so do you have any issues paying for your prescriptions currently?
No.
Okay, that's great. But if that should change for any reason at all, I want to make sure that you call your provider and let them know right away. That way they have some resources and things like that. We can get you in touch with some different community groups and things like that, so that you can make sure that you're getting your medications, okay? Do you have any other questions for me?
No.
No. Okay, thank you.
Thank you.